Would you like to save some money on your health insurance premiums? Hi, I'm Tommy at medicalinsurancetoday.com. Savings is the topic. Everybody's interested in some savings. With the cost of living out there is crazy as it is, some savings on healthcare, which is out of control expensive in my view, in my estimation, is hopefully something you could get use out of. So savings, I have helped thousands upon thousands of people in my career, and I'd say 90% of them, when we enroll someone new, they're saving money on their health insurance. Most people aren't looking to buy more, pay more for their health insurance, so it's a common practice. Our goal here at Medical Insurance Today is to find you the most affordable plan that you can buy at the lowest possible premium that's out there. Meaning, if you are paying too much, our goal is to help you save some money when you buy a new policy. Now, that's not always the case, but it's 9 times out of 10, we're going to be able to save you some money. So to explain a little bit about what that means, first I'd like to give you my personal situation with my family. You know, about 5 years ago, my wife and I decided to move to an HMO plan from a PPO. I've historically been a PPO person, and for the last 5 years, this year, I'm saving over $10,000 in premiums for this year of 2025. And if you measure that out over 5 years, it's not quite 50 grand, but it's been in that $8,000-9,000 a year that I've saved. That's going to help me put my kids through college someday, hopefully, because things are expensive enough. And I didn't want to move to an HMO. However, moving to an HMO saved me a bundle of money, and it worked great for me. Now, that's not going to be the case for everybody. Some people are going to have to be on a PPO. So I want to break this conversation down into a couple different parts and how you can save some money in your healthcare and still make it work properly for you so that you're not giving up any value and that you're just reaping the savings and still accessing great healthcare. That is our goal for our consumers, is to make sure that it's the right plan for you and your family and at the lowest possible cost. So, touch on plans. Now, under the Affordable Care Act, you have bronze, silver, gold, and platinum tiers of coverage, as they're known. Now, tiers of coverage, bronze being the least expensive, and it goes up periodically and methodically up to platinum being the most expensive. And for most folks, a bronze or silver plan is going to be enough coverage. Now, many people will come in and ask for gold or platinum coverage, and we're happy to do that for them. However, we're going to start at bronze and silver because 75% of people enroll into a silver plan. It's a little bit more than that, but around 3 out of 4 are going to roll onto a silver plan, and it is plenty enough coverage. Me and my family are on silver, and I'd say more than 75% of people walk out of here with a silver policy. Bronze works for people that are healthy and are just looking for the lowest premiums. Gold or platinum, there is no inherent value in a gold or platinum plan. The tiers are strictly a measurement and a mathematical equation of copay and deductible. At bronze, you're going to have the high copay, high deductible, and as you go up, the copay and deductible gets a little smaller. When you're on a platinum plan, there's no deductible and a lower copay. However, in my estimation and my math breakdown, is gold or platinum are not worth the money that you're paying for them because there's no real inherent value. And when you put them side by side to a silver plan, silver is less expensive and it will also give you very comparable copays. It's not a big savings to go up to a gold or platinum. You don't lower the copay that much for what you pay to go up to that coverage. When I say there's no inherent value in them, you don't get a special list of doctors, you don't get special preference at the doctor's office, you don't get a special network of physicians that you have access to. And again, it's strictly a mathematical equation. Many people won't believe that, and you have to explain it, and I'm happy to do that. But there again is no inherent value in a gold or platinum policy based upon preconceived notions, is what I'll say. Next is the conversation about HMO and PPO. I'm going to avoid getting into too much detail about this. People have definitely a preconceived notion if you're a PPO-minded person, which is great and fine. But if you are PPO-minded, you generally are going to have an affinity to HMOs. HMO means you got to have a primary care doctor, and that doctor, primary care, refers you to all your specialty care. So most people measure out, I don't want to deal with the stress of a referral. Fair enough, but let's do some math. And this is what we're good at here at Medical Insurance Today. It's doing the math for you and letting you decide ultimately what you buy. But I'm going to make a case that HMOs are going to save people thousands upon thousands of dollars annually, which they've done for my family, which it has done for my family, and it can work. So let's say that you're paying $1,000 for a PPO, but your HMO is $500. That difference of $500 a month, if you annualize that out over 12 months, that $500 a month is $6,000 for the year that you would save by going to an HMO. That's real money. So pending your health if you don't go to a specialist a great deal throughout the year, to save potentially $6,000 as an example, is that worth having to work through a primary care doctor and to get a couple referrals to go see your specialist for your dermatologist or your cardiologist or your orthopedist or whomever you need to see on the specialty side? In my estimation, yes, it is. And I've gone through some health issues in the most recent years and dealt with a lot of specialty care. And I can tell you the HMOs work great if you have a good primary care doctor and if you have a good network that you're affiliated with through your primary care. That said, back to savings. If you're paying too much, it's worth measuring out. It doesn't hurt to shop, to get an idea of what's out there, and then we do all that work free of charge for you, the consumer, to measure out what you have, talk to you about your doctors, talk to you about your medication, talk about how much you use your insurance to give you an honest recommendation. And generally, we're going to look to save you money and as well keep you in a quality plan to make sure you're not sacrificing anything while you're saving that money. It's not about cheap. Insurance is not something you want to go cheap on per se, but there are ways to save. And that's something I can guarantee you. If you're paying too much, if you came and talked with me today, I am certain I could show you value and save you some money. Now, whether or not that would be the right plan for you is another story, but there is something less expensive out there if you are struggling with the cost of healthcare. Many people are. Most people that sit down in front of me are struggling with their cost. So, that said, please be in touch if we can help you. If you'd like to measure out the cost, there is savings out there for you, and there is a plan that can work, and we would love to help you find it. MedicalInsuranceToday.com, and we look forward to serving you.